Delirium is acute. It's the sudden onset of confusion. It's associated with an inability to relate to the outside world. It's associated with people not being able to hold on to a concept for more than a couple of seconds. It's often associated with hallucination. So they're looking round, they can't attend to what they're doing. It's sudden onset. Dementia, on the other hand, is a slow, gradual impairment in a person's memory, in their thinking, in their behaviour, in their personality. It comes on over years. Delirium comes on over hours. That's the difference.
She became a little less not wanting to go out, to stay at home. She changed also her sense of humour. She became quite funny when she was talking to people, and she'd make people laugh and they thought she was hysterical.
The experience was rather frightening. Support, yes. I come into a period when there was a lot of support had to come from me. I was doing all the cooking all the time, and it wasn't very long after that when we had to take it. We were taking her to the toilet, and that was a rather traumatic, but a change of life to be taking your wife to the toilet,
So Maud was sitting in a chair, she fell sideways, and as she fell off the chair she cut her hand, and so she had to be taken down to hospital. And as they were assessing her for her hand, they noticed that her mental state was a little bit confused, and were quite worried about that.
Elderly people who are confused or with dementia have higher care needs. They need more time from nursing staff, they need more supervision. They are more at risk of falling within the emergency department, or not having their needs met because people are busy doing other tasks.
She went to bed early, about 8 o'clock, 8:30. I went inside to turn the telly off and whatever, and to come back out. When I came out, she's sitting on the floor next to the bed. And I said, "What are you doing down there?" And she said, I fell out of bed. In the morning when I got up, I checked her out again. I said, "Well, how do you feel?" "Oh, I'm just a little bit sore here," but then she had great difficulty in answering you directly too, with a real answer.
Delirium is when you get a sudden deterioration in your thinking, really cognition, and in your attention. So suddenly, instead of being awake and alert and able to answer questions, you're either really dopey and drowsy and not with it at all, or you're so high that you're seeing spiders on the ceiling and you're picking at things, and you can't listen for more than 2 seconds to what someone's asking you. It's something that comes on really quickly, and if you see someone acutely confused, you can't miss it. However, you can get a delirium where people get really dopey and drowsy, and when someone's just sort of sitting there with their eyes shut, looking, and you don't pick it. But delirium is an acute change in a person's mental state.
I rang 000. They worked on her for half an hour, making sure that there didn't appear to be anything broken. At the finish they said, "No, we cannot find anything that's broken, but we think she should go to the hospital and have an x-ray." So they wheeled her in the ambulance. She wasn't sure what the hell was happening, and they took her up to the hospital.
A delirium is a medical emergency. We don't actually know exactly what's happening in the brain, but clearly there are major things going wrong. It's a cholinergic deficit, so a deficit of acetylcholine, but it stops the brain functioning. People die from delirium. People become disabled after delirium. They spend longer in hospital if they have a delirium. It's a very dangerous condition to have, and so we try and avoid it.
They didn't actually ask us to go.
No.
They just said, "Look, come up in a half an hour or
That's
so.
right, yeah.
There's
An hour,
nothing
that's
you
it.
can do until we actually get there," and
Admit
she's taken in and that. So, yeah, when I got there, she was still in the alleyway in the bed, all strapped up still. I think that experience for her was absolutely frightening. She even if she knew where she was, she was frightened because she thought her life was coming to an end, basically.
First they gave her very quickly hip x-ray, very nearly as quick as she got here. Then they put her back in that holding room, but the fellow in charge of the x-ray department was not satisfied with the hip one. He wants a MRI, yeah. Now Joan had no earthly idea what was involved with an MRI. They just picked her up and said, right, we're taking Mrs. Knight down for an x-ray, for an MRI. Away they went. Me and Liz were there. I said, come, we'll get a cup of coffee and we'll just stand here at the door at the front of the hospital here. We did that. I'd hardly got there before they called me over the PR system. Would I go to the x-ray room immediately? I went down there and she was screaming. They had her strapped in on the MRI system. She didn't know what the hell it was all about, and she was screaming. And the boss of the x-ray division said to me, and the sisters that were working there, would you hold her hand while she goes in and out of the tunnel? And away they went. That woman screamed from the time I come close to her, even before I did, as she went into the tunnel and out of the tunnel, all the time. And all she could say to me was, don't let them kill me, Charlie, don't let them kill me, don't let me die. That's what buggered me.
So for elderly patients in the emergency department, I think family and carers have an enormous role, because these people often have specific needs. There are specific things that will upset them, and there are specific things that may cause them to put themselves in danger, and families are usually aware of those things, and they can let us know so that we can try to keep them safe. The family's also really useful because they know what the baseline is, they know what their normal behaviour is, but they can also participate in the care and make the person feel more at home and more comfortable because there are familiar faces around.